Okay, chapter 16 is an introduction to basic pharmacology. This course is not designed to cover much in pharmacology. I try to pull it in wherever I can, but this is just a basic introduction. Pharmacology, by definition, is the study of drugs, their actions, dosage, and therapeutic uses or indications and adverse effects. Drug therapy is directly linked to the pathophysiology of a particular disease. It may be important to recognize the difference between expected manifestations of a disease and the effects of a drug. Now, a drug is a substance that alters biological activity in a person, and there are multiple reasons for prescribing drugs. The first one is to promote healing, like, for example, an anti-inflammatory or something like a glucocorticoid. The second reason is to cure a disease, like an antibacterial or an antiviral type medication. Number three is to control or slow the progress of a disease, like chemotherapy or radiation. Number four is to prevent disease, like taking a vaccination to prevent the flu or any other type of disease. Number five is to decrease the risk of complications, like taking an anticoagulant to prevent stroke. Six, to increase comfort levels, like taking analgesics for pain. Seven, as replacement therapy, like insulin or Cinemet, something to replace dopamine, or Synthroid to replace thyroid hormone, or hormone replacement therapy. Number eight, to replace excessive activity in the body or reduce excessive activity in the body, like a sedative or anti-anxiety medication. Food and Drug Administration, or the FDA, has the legal responsibility for deciding whether a drug may be distributed and sold. Drug effects may stimulate or inhibit cell function. For example, conduction of impulses by neurons or secretions from glands. Some drugs are antihistamines, and they block histamine production in tissues, which would reduce swelling. Physical or mechanical action, laxatives, or antacids. Drugs are classified or grouped by their primary pharmacologic action and effects, such as antimicrobial or anti-inflammatory. Indications are listed for a specific drug in a drug manual, which provides the approved uses or diseases for which that particular drug has been proven effective. Contraindications are circumstances under which the drug should usually not be taken. For example, in the case of renal failure, do not administer a drug that is eliminated by the kidneys because excessive drug will accumulate in the body and cause toxic side effects. Side effects are mild unwanted actions of the medications, like chemotherapeutic drugs causing nausea, vomiting, or alopecia, which means hair loss. Adverse or toxic effects. These are effects that are dangerous because they can cause tissue damage, or they can generally be life-threatening, like causing excessive bleeding. Coumadin is one of these things that can result in excessive bleeding if given in excessive amounts, and it does have a very narrow therapeutic range. In these cases, the drug can be discontinued or dosage can be lowered. It can be a prescribed drug, or it could be an over-the-counter drug that's causing the problem. Megadoses of fat-soluble vitamins in particular, and acetaminophen, can cause kidney and liver damage. In late 2000, phenylpropanylamine, PPA, in cough and cold and appetite suppressants were removed from the market because of the risk of hemorrhagic strokes in young women. Specific forms of adverse effects that should be noted: hypersensitivities, allergic reactions to drugs. Penicillin and local anesthetics are common. can be mild or may result in anaphylaxis. Medication should be discontinued immediately and the physician notified. Aspirin. Giving aspirin to children can result in Reye's syndrome. 2. Idiosyncratic, unexpected or unusual responses to drugs like excessive excitement while taking a sedative, which is a sleep-inducing drug. Penicillin causing anaphylactic shock in some individuals. 3. Iatrogenic, negative effects due to a med error, drug overdose, or unusual response. 3. Teratogenic, harmful effects on the fetus, which can lead to developmental defects. Something like thalidomide, and you can look that up. It was something that was prescribed for morning sickness in women in the 50s, taken off the market because it hindered the formation of limbs in the developmental pathways of the fetus, and now it has been brought back as a treatment for some types of cancers, as long as you're not of childbearing years. Interactions. Combinations of drugs may modify the effects. Synergism, antagonism, and potentiation. Synergism is where a combination of two drugs can sometimes cause an effect that is greater than the sum of the individual effects of each drug given alone. The additive effect of ACE inhibitors and St. John's wort can be a negative thing, so you have to be careful of that. Sometimes you can perpetuate a sleeping medication by adding it with Neurontin. Antagonism is decreased effect. Taking Sinemet with B6 can diminish the effects. Potentiation, one drug enhances the effect of the second drug. And sometimes people develop a tolerance, and a tolerance is where the effects of a given dose diminish as drug treatment goes on and increasing amounts are needed to produce the same effects. Opioids do this, and so do benzodiazepines. The majority of drug overdose, by the way, drug overdose cases and fatalities in hospital emergency departments result from drug-to-drug or drug-alcohol combinations. Just something to keep in mind. Administration and distribution of drugs. Dose is the amount of drug required to produce the specific desired effect in an adult, usually expressed by a weight or measure and a time factor like 2 times a day, for example. Loading dose is the initial high dose that's given to achieve the effective drug levels quickly and is common with antimicrobials to fight microbes as soon as possible. Frequency of dosing, important in maintaining effective blood levels without toxicity. You have to follow the directions very carefully. So here you see 3 graphs that's showing you what can happen, and the first one shows you that by taking regular doses of the drugs, it maintains the blood level at an effective dosage to eradicate the problem. The second picture down shows you the effects of taking the drug at irregular intervals, missing dosages, so the blood levels go too low, and that can cause resistance, and it can cause the microbial infection to rebound and diminish your ability to recover from the infection. Now the third picture shows what happens if you double the doses or take them too frequently, and that can put the dosage of the medication into unsafe or toxic levels, which can result in kidney and liver damage. So you have to be very careful to make sure that you follow directions in taking a prescribed medication. These are the different types of administration of a particular drug, the convenience factor, and how long it takes for the drug to act, and how the drug is actually lost through the system. So you can go through this on your own and look at this and look in the book at different examples. There's 2 slides here that relate to this: oral, sublingual, under the tongue, subcutaneous injection, then intramuscular, intravenous, inhalation, topical, and get familiar with all the different types of drug administration. When you are taking a drug, you need to be to consider the timing related to meals and sleep patterns need to be monitored. Some medications need to be taken with food, and in others, food may interfere with absorption. Some need levels that can be regularly checked by ordering a lab test for actual blood levels of the drug, and this may be requested if toxicity is suspected. The next slide is showing you different methods different ways drugs are absorbed, how they're distributed, and how they're excreted in the body. So gradual absorption occurs when you orally take a medication because it has to go into the stomach or intestines, be absorbed, be metabolized through the liver, and then go into the circulation and then get to the desired tissues. Now, intramuscular has to go into the muscles, and then it gets absorbed into the bloodstream and then to the tissues where it's going to have an effect, the receptors for that medication. Then you have intravenous that goes right into the bloodstream, and that's probably the quickest. And then all of the drugs eventually will be taken by the blood through the kidneys, filtered there, and then the drug metabolites go out in urine. So that's three different ways that drugs are absorbed, how they're administered, and how they go through the system. Now, drugs generally are designed to have certain receptors that they bind to. And the first drug here in the green little block here, these are drugs that stimulate increased activity because they bind to a receptor that's going to enhance the effect of that receptor. Something like Synthroid. Synthroid binds to receptors on the thyroid gland and causes the thyroid gland to produce more thyroxine. So it replaces or enhances the effect of TSH. If you don't have the TSH, then this is what's going to take the place of that. Drug number 2 is a beta blocker, an example of this type, something that would decrease the activity. So if these are beta receptors, the medication binds to the beta receptors and blocks that particular receptor. So somebody that has a heart that is being affected by too much stress in the person's life, beta is stimulatory for enhancing activity in the heart, so they take this medication that binds up the beta blockers so it slows the heart rate down. So many of the pharmaceutical products that are designed have certain receptors that they act on. And usually, just generally speaking, this is overly simplified, but either to stimulate or decrease activity of a certain cell by binding to specific receptors. Prescriptions and med orders. A prescription is actually a signed legal document that must include a patient's name, address, if age of significant, the prescriber's name, address, and ID, the date, the name, and the amount of the drug, the dosage, the route, the directions for taking the drug, and permission for additional quantities. Each drug can be identified by a chemical name, which is used primarily in research, a generic name, a unique, official, and simple name for a specific drug, and the other name is the trade name, assigned and used only by the manufacturer. For example, the generic name would be, say, hydrocortisone. Trade names could be Cortef, Cortate, Cordome, hydrocodone, Synacort. All different names that relate to the same thing, but make it easier for the patient to remember. Example of names given to a common antibiotic. Say something like ampicillin. The chemical name is derivative of 6-amino-penicillinic acid. Generic name is ampicillin. Other brand names: Omnipen, Ampi, Principen, and Penglobe. Families of drugs. Members of a family of drugs can be identified by the similarities of their generic names, like diazepam, which is part of the benzodiazepine family, these are anti-anxiety agents. Other members, lonazepam, lorazepam, oxazepam, and they all have very similar sounding names. Drugs that are over-the-counter and schedules. Over-the-counter medications should be noted in the patient's drug history because they can interfere with other medications that the patient is taking. We've talked about synergism, antagonism, potentiation. Other drugs considered a greater risk are classified in official schedules according to their side effects and potential for adverse effects, abuse, and dependency. Their sale is restricted and prescription requirements set accordingly. New drugs involve long-term trials and research. Guidelines have been established by government agencies, and it takes approximately 10 to 15 years for the development of a new drug and effective research to be conducted so that drug can be approved for public use. There are other traditional forms of therapy. This is a multidisciplinary approach to providing therapeutic intervention. Physiotherapy assesses physical function and works to restore any deficit and prevent further physical dysfunction. Many include exercises, ultrasound, electrical nerve stimulation to alleviate pain and gain increased mobility in a joint. They work with stroke victims to help regain function, rehab, long-term care, amputees and those recovering from brain injuries, spinal cord injuries, heart patients also. Occupational therapy provides a functional assessment of patient capabilities related to normal activities of daily living, aid with in-home safety, and helping individuals to live independently. Speech and language pathologists help with those with communication problems. Nutritionists, dietitians aid in modifications in eating necessary with some diseases, help with meal planning, etc. And there's all sorts of different categories and subcategories. There's massage therapy, there's osteopathy, chiropractic practices, and all these therapies are listed and described, in your book. So if you want to read about any of these, and some of these might be careers you may want to research and go into on yourself. So something to look at. And many of these therapies actually have roots in Asia, where the emphasis is placed on preserving a healthy lifestyle. And the approach to disease and healing is generally holistic, looking at the body as a whole. And it's a more comprehensive approach, recognizing the way that the body works together in the relationships of the body, mind, and spirit. There's other examples: acupuncture, reflexology, and craniosacral therapy, or some more. So again, do your own research. But that finishes up chapter 6.